Now, from the News Channel 5 network, this is Medical Mondays.
Hey everybody, Rory Johnston with you live here on News Channel 5 Plus tonight. Thanks so much for tuning in. It's time for Medical Mondays, and our good friend Dr. Tif Siragusa is back with us. You came back for more, huh?
I enjoyed it the first time.
We appreciate it. Still got the scrubs on. This is how dedicated he is.
It's been a long
coming
day.
in after a busy day.
Right.
We appreciate you spending the hour with us tonight.
Thank you.
And viewers, as we always say, great opportunity for you to call in 737+ and get some great medical advice from some local experts. Dr. Siragusa is a vascular surgeon. He is with Siragusa Vein and Laser Center, a couple of locations here in Nashville, and we'll get you all that information before this hour is up. So be sure to call in as we talk about not only vein disorders, but also the cosmetic treatments that come along with that. And you're busy today, huh?
Right.
How much of your practice is just in-office work, and how much are you actually performing surgery?
Probably about 80% of what we do is in the office. Maybe 20% is in the hospital.
Mm-hmm. Okay. Tell us a little bit about your actual operation. Who works with you? How long have you been doing this?
Right. So what we do for varicose vein disease in the office, which is the most common condition that we treat, is we use either laser or radiofrequency energy to seal off a leaky vein. Varicose veins are typically caused by valve problems in veins, and the best way to fix that problem is to seal it off using heat. We do this in the office. It takes about 15 minutes or so. It actually takes longer to get ready for the procedure than to do it, and patients are up and on their way to normal activities as soon as we're done.
What do you mean by getting ready for the procedure? Why does that take longer?
We use a full operating room sterile technique. The procedure itself is very minimally invasive, done through an IV. But just to reduce any small chances of infections, we prep the legs just like you would do if you were doing major surgery on the leg. And we get everybody covered with blue drapes, and it's all sterile technique. So that takes a little bit of time, actually longer than the actual procedure.
Wow. All right, 737+ everybody. We've got a number of things we're going to talk with Dr. Siragusa about tonight, including, I know a lot of you are interested in all the advancements, and last time he was here we talked a little bit about this. In case you missed it, we'll go over some of this stuff again. Really remarkable advancements with technology and the treatments, cosmetic treatments that are available, and so much else. But let's start with deep vein thrombosis, which we talked a little bit. I got educated a little bit last time you were here, but
right.
What is it and why do we hear so much about it?
Right. Deep vein thrombosis refers to a blood clot that forms in the deep veins, usually of our legs. And these clots, when most people think about them, they think of a marble or a pea-sized little clot of blood. But these clots are actually more like snakes. They're long, tubular clots that sit in a vein that can run all the way up and down your leg. The problem that deep vein thrombosis can lead to, number one, it causes leg swelling. It can cause severe leg pain and leg swelling. The other thing is that these clots can break free, and if they break free, then the blood carries them to your lungs where they can get stuck in the lungs.
Right.
When that happens, that's called a pulmonary embolism and can be fatal.
Right.
And is one of the more common causes of mortality in the United States.
Is it, it must be interesting for you when you have someone come in to see you who's having some issues, and you can literally save a life when you realize,
right,
left untreated, this could be fatal.
Right.
And do you end up telling a patient that, or do you treat it and say, gee, thanks for coming in, or do you tell them the truth and say, I'm glad you did because you could have died?
You know, we do a lot of educating, and part of that is any patient who has this serious condition needs to know exactly what's going on and what they need to do to improve it. But also, the more that their family knows and the more that anyone knows about this condition, if they have a friend or a loved one who develops, for instance, severe swelling and pain in one leg, it's usually on one side rather than both legs, then they need to be alert that that could be something serious like a blood clot and get it checked out with an ultrasound.
All right, we already have a caller coming in, and we do hope you'll take advantage and call in as well at 737+. Let's go to our first caller. Hi there, welcome to Medical Mondays.
Hey guys, how y'all doing?
Good. What's your name?
This is Tara, T-A-R-A.
Hey Tara, go ahead. What's on your mind?
So I have very fair skin, and my veins are really visible anyway, but I'm starting to approach my 40s, and I'm noticing more visibility in veins, specifically around in my legs, lower legs, and even on my face. And I just wondered if there were things that I could do to help keep that at bay, and then also if I were to take action, what kind of options would be available, and what kind of price point am I looking at? Because I assume that this is not covered by insurance.
Sure. So one thing for visible veins, especially spider veins, the best thing that anybody can do to prevent them from getting worse is to wear compression socks. And these come in a variety of different colors and styles, and they'll basically mix right into anyone's sock drawer with any pantyhose or regular socks that they typically wear. That's the best thing to do for prevention. As far as for treatment of visible veins, especially in fair-skinned people, a lot of times you can just see their veins, and their veins are normal. They're doing their job. It's just their skin's very fair, and in that situation, you really don't want to do much for that. But for the ones that stick out, the ones that really pop when you look at someone's leg, the purple or the reddish ones, those are best treated with injections. Insurance does not cover the cosmetic treatment of varicose veins. However, each session of injections is about $300. Most people require 2 to 3 sessions to get complete resolution of the problem they're looking to address.
Sure. Tara, thank you. 737-7587 is the number if you'd like to talk with Dr. Siragusa tonight here on Medical Mondays. Long-term problems, though, related to blood clots, other than obviously some can be fatal, but what happens as we get older and these issues develop slowly and maybe we leave them untreated?
Yeah, so once a blood clot forms in our vein in the leg, the body does its best to dissolve it. And patients with blood clots in their legs are put on blood thinners, usually for 6 months is the standard time period. During that 6-month period, the body has a chance to get rid of the clot. Not always is that the case, though. Sometimes the clot is so well established that the body's not able to break it down, and that clot becomes what's called chronic DVT. Now, chronic DVT is not as dangerous as acute or fresh DVT because it does not really pose you a risk of traveling to the lungs and causing pulmonary embolism. Right. But it does present a problem with long-term swelling in the leg. There are several patients who will present to the ER this week with a swollen leg and a history of a blood clot 10 years ago. And the concern is, do they have a new blood clot? Right. And most of the time they don't. This is just a problem that has resulted from the history of their old blood clot.
Does this happen, doctor, at a specific age? Or
not really. Age is a small risk factor for developing a deep vein thrombosis, but the more prevalent and important risk factors are obesity, sedentary lifestyle, cancer.
What about things like gender, ethnicity? How much of a role do they play?
Not as much. Not as much when it comes to blood clots. Blood can do only 2 things, really. It can stay as a liquid and circulate, or it can form a clot. And when we get a cut, we want that blood at the site of that cut to form a clot and stop bleeding. Right. But when the blood's in our body, we want it to stay liquid. And so certain things affect both men and women and all genders as far as that blood's tendency to clot.
When you were in medical school, and I've got your whole bio here, and it's too much to read, to be honest with you, and it's all on Dr. Siragusa's website, by the way, but really an impressive resume. What made you at that point when you're in medical school, when you start to decide, it's sort of like in college when you decide on a major, that you wanted to go into becoming a vascular surgeon? Well,
the circulatory system really affects the whole body. And so I thought this was the best way to be involved with taking care of a real wide variety of problems that affect really every age. A lot of the things we take care of with varicose veins are in patients like the caller, young people, but we also take care of abdominal aneurysms, carotid artery disease, and things that happen at a different stage in life.
Sure. All right. With that, we're going to take our first break, everybody. 737+, the phone number if you'd like to join in the conversation here with Dr. Siragusa. We talk about vein disorders. We're going to get into some interesting cosmetic treatments as well when Medical Mondays rolls on. Stay with us.